If you go ahead and get seated, we'll get started so we can maximize the amount of time that we have to discuss these, in some instances, fairly complex issues, and dispelling some of the, or putting some facts. If we focus on evidence-based, we also need to be fact-based. And what I'll do in my presentation is to address that question that comes up all the time. How come there's no deals? How come there's so few? Is it just because it's a new idea, or is it because of other reasons? And what I'll do is give the other reasons.
And Rob, let me introduce you.
Okay.
Too, so everyone knows who you are.
Right.
I love your enthusiasm. Let me say that. It's going to be an exciting presentation. But Rob Duggar or Duggar? Duggar.
Yes.
Rob Duggar is the founder and managing partner of Hanover Provident Capital. And he's already been referred to by Megan as leading one of the first pay-for-success financing arrangements in the country, and so is a true pioneer in this space. And I think he's going to reflect both on his experience, but also look to the future in terms of whether this is a movement that can really catch on or not. So, Rob, we're so pleased that you're here. You're a breath of fresh air to the world of population health improvement, let me tell you.
I hope this is, you'll feel that way after I'm done. That's always the challenge. Basically, I didn't know what this group actually wanted to focus on. I didn't have a clear idea. I didn't have a conversation with Debbie Chang, who always generally provides me the guidance I need for these kinds of things. So what follows is a kind of hodgepodge, but since having sat through the last couple of discussions, I have a much better idea of what the group is focused on. So I will quickly just flip through the slides that you can grasp, or you've already completely digested and need no comments from me. Basically, the central idea behind pay-for-success finance is in early childhood is that we all know from the work of Jim Heckman, Nobel Prize winner, and by the way, I'm affiliated with two organizations, Ready Nation, which I helped found, and the Human Capital Economic Opportunity Working Group at the University of Chicago, which I co-chair with Jim Heckman and Stephen Durloff at Stevens at the University of Wisconsin, but Jim is obviously at the University of Chicago. So this is sort of an amalgam of both the work of Ready Nation and the Human Capital Economic Opportunity Working Group. The working group is a group that you may want to take a look at yourself. It's about 400 researchers across all fields of health, psychology, behavior, economics. Though it's called Human Capital Economic Opportunity Working Group, it is fundamentally cross-disciplinary, because what it is looking at is what does it take to create the most important product in the entire society. We think about airplanes and cars and boats and houses and all that. So what is the most important product? A ready-for-life 18-year-old. That's the most important product, a ready-for-life 18-year-old. And that's what the Human Capital Economic Opportunity Working Group is focused on. And Ready Nation, obviously, is the group that's focused on building business leadership support for this. You know the story about 700 neurons per second. That's why what happens to a child at age 1 is more important than what happens at age 3, and that's more important than what happens at age 5. Obviously, from Jim's work, we know conclusively from a very, very thorough microeconomic research standpoint that the investments in children at the earliest months and years of life have higher returns than later years, in fact, very, very significantly higher returns. These returns are calculated over very long periods of time, and the breakthrough that's occurred over the last few years is the awareness that you don't have to wait 15 years. You don't have to wait until you get drops in teen pregnancy, drug use, and adolescent crime to get high rates of return. It happened that in the remediation areas where economists had not really researched, there were these findings with respect to neonatal intensive care and special education. The area that Megan talked about a moment ago has to do specifically with what can be done with prenatal counseling and subsequent work with the mother in any one of a category of home visiting programs. But what we know that they can reduce infant health, improve infant health. I should have said improve. What does it say? I hope it says costs. Oops, it doesn't. I wrote this rather quickly this morning. In 36 months to pay for the programs, and this site at the bottom is Megan's paper. Just to give you a site to something that bears probably a little bit closer to what you are used to, what we're looking at in Virginia is the amalgamation of managed care and Medicaid in efforts to specifically operate within that realm. And this paper, done in 2008, Searching for the Business Case for Quality Medicaid Managed Care, pointed out that the intervention for high-risk pregnant mothers produced a 1.26 to 1 return. 26% in 1 year is plenty, and you can make it work at that. But do you get that return? If you reduce the instance of neonatal intensive care use from, say, 10 kids to 6 as a result of a really solid nurse-family partnership or other home visiting program, you drop the use of neonatal intensive care for anyone of not just premature, but low birth weights or drug problems or other birth-related challenges from highly stressed, at-risk mothers. Do you get that savings? Well, you do. But do you get it the first year? You know the first day, almost, that the neonatal intensive care use is going to drop. But do you get the savings? The answer is, I'm on the board of the Alexandria Hospital, one of the Inova hospitals. And we've looked at this, and what we find is that we still have an intensive care unit facility that is still being amortized. I mean, this is hundreds of thousands of dollars of equipment that's in one place, and it's still being amortized. We have nurses and doctors that are under multiple year contracts. So even though we reduce intensive care use immediately, we don't get an immediate we do get variable cost savings, but much of the costs associated with high birth risk is fixed costs. And that takes longer term to deal with it. Now, they dealt with this in the issue in New York. As they closed different portions of the adolescent prisons, they accounted for the fixed cost amortization. And we can do the same thing here. But this is an aspect of social impact finance or pay for success finance that has not quite been completed. And one of the exciting things for me to be here was to at last meet Nancy Anderson. Nancy Anderson runs an institution, low-income investment fund, which, like a couple of others, has a long, solid track record. And it's institutions like that who can put together the financing that captures variable cost and fixed cost reduction. That's what you need to capture. Okay. Pay for success, as Megan successfully convinced me when we were writing a paper together a while back, that we need to talk about cost avoidance and we need to talk about outcome improvement. That's what performance is all about. Here's some details. This is available to you. You can read it in greater detail, but I'm going to flip through here to just focus on a couple of things that need to be. First one is this step right here. Organizers study the feasibility and decide whether to move forward. Now let's take either early health or early learning. But let me just give you an example, and you can immediately apply it to early health, since that's an area you know about and I know less about, but I know a fair amount about early learning. Every Pay for Success project is specifically linked to a specific intervention. A Pay for Success project is like a mortgage financing. You don't do a mortgage financing on the average house. You do it on a house, a specific house. And therefore, there has to be an appraisal, not for the average house in the county, but for that house in that neighborhood, that house. The feasibility study is the document which underlies the whole transaction. It says that this pre-kindergarten program reduces special education costs by that amount, and the present value of that amount of 8 or 9 years of special education cost avoidance is enough to pay for the pre-K. Not the pre-K program down the street, but the pre-K program right here. That's the one we're looking at. There are lots of curriculums. Some are good and some are bad. Sometimes you need 2 years. Sometimes you can do it with 1 year. But whatever it is, the actual appraisal, what we call the feasibility study, is the whole thing. Now, what do you need to do with a feasibility study? We've got a really, really great pre-K program. The teachers in the public schools say, oh, the kids that come out of this pre-K program are just absolutely great. Do they have 5 years worth of background data on their kids? Can they tell you which kids went through that program so then you can track all the kids who went into the public school? Not just the stars, because those are the ones that the teachers remember. They don't remember all the kids. They need to know all the kids that went through, and we need to compare those kids with a comparable set of economically situated other kids. We can't do quite randomized control trial, but we have to do something fairly close. Do they have the data? Answer, virtually none of them have the data. That's the first problem. Pre-kindergarten programs or health home visiting programs need to have information on the kids that they have treated. It's not enough to use the Nurse-Family Partnership general performance data. You've got to look at the specific programs in South Carolina or in Virginia or wherever. You need the appraisal on the house. That's the first problem. Second problem. For pre-kindergarten, kid arrives in kindergarten and either gets assigned to special ed or doesn't, or some sort of combination of it needs it for his eyes, but we can get glasses and that fixes that problem, or whatever it is. Do we know that it's the result of the pre-kindergarten, or is it a result of something else? Maybe the child went through a really solid nurse-family partnership program, then never attended anything else and showed up at kindergarten. But as a result of what that nurse practitioner did with that mom in the first 6 or 7 months of that pregnancy, when that mom was receiving all this information and then became sort of lit on fire about what it is that's necessary to raise a kid, and she learned, okay, I need to read, I need to talk, I need to spend time with this child, I need to feed this child the right way, I need fresh vegetables and juice and bread and all this, and they learned all this. So the child arrives in kindergarten, doesn't get assigned to special ed. Now, suppose the child had gone to kindergarten, didn't get assigned to special ed. Was it the result of the nurse-family partnership, or was it the result of the special ed program? If you don't have information on whether the child attended, was a recipient of a home visiting program, or even mother is a drug addict and is separated and is sent to rehab, dad has to take over. Dad doesn't know anything about kids. He's a great plumber, but he doesn't know anything about kids. And he's a young guy. He's 20 years old, and he's out with his buddies. He left the baby in the apartment with the bottle in the crib, and he shut the door and locked it so the baby would be safe, and he went out with his buddies, and he didn't show back up until 5 o'clock in the morning. Well, when he was met at 5 o'clock in the morning, the sheriff was there because a neighbor happened to see him leave, knew the baby was in there, heard the baby crying, and called county welfare. Next thing he knows, he's standing in front of a judge for felony neglect. He's either going to do hard time or go to a program in which he has to go 5 weeks through this parent as teachers program. Aggressive. He has to sign it. He has to take a test every week. And at the end, he has to take the test and pass it in order to be merely on probation. He does. He finally, he's a young guy. He loves the kid. He thought he was doing the right thing, but now he gets it. Now he's reading to the kid. He's spending time with the kid. He's making sure the kid's eating right and everything else. So here's a felony prosecution for neglect, which actually turns the father around, turns the kid around, and then the kid goes to pre-kindergarten, goes to public school, does not get assigned to special ed. Was it the pre-K, or was it a really, really tough judge who set that young man straight? We don't know. But if we don't have data at kindergarten entry on what kinds of experiences the child has been through, we can't make a solid case that it was just pre-K, the pre-K that we're trying to fund. Okay, so the data demands for social impact finance are very high. And the later in a child's life the intervention is occurring, the higher the data challenges are. Okay, so that feasibility study, that's what that's all about. It not only has to answer the question of does it have the result, do the kids have a result, but actually show that the result is solely the result of that intervention, whatever it is. I'm just going to quickly, here are the contracts that are necessary in a social impact finance. There's a state law or some sort of state structure that has to be there. There has to be, those dark blue circles are individual contracts. There's a third-party evaluation that's enormously important. It has to be separate to certify that the provider did what they said they were going to do, and that the government agency or other remediation cost occurring entity, a hospital, a public hospital, whatever it is, incurred the savings, avoided the cost that the contract calls for. So there's a very important contractual issues here, which, trust me, are only now beginning to be understood. This is another important reason why there are so few social impact finance transactions. Flow of funds, Megan went through this. This one does the same thing clockwise. Here's the whole deal with the contracts in place. You can see where the money has to go through a contract. And because it has to go through that contract, that's a huge sort of infrastructure arrangement. Because as Nancy could tell you, there's no way to transmit money from one place to another without a stack of paper with a lot of signatures in between. Okay, establish a funding timeline. How long does this take? I'll just quickly go through this. For state law and an unknown, establishment fundraising phase for 18 months. This is just a set from ground zero. Though it took 4 years to complete the Salt Lake City project, actually from the 2 months from the beginning to end, once everybody got it in their head what they're going to do, it took 18 months to put it together. Here's, in general, this is what it looks like. 8 months for prenatal to, for prenatal counseling, 60 months for pre-kindergarten. And this is, no doubt will be on. Now, you asked me to spend some time on the Utah project. Utah expands, and you must tell me about time if I'm going too long, okay?
You're good. You see the lights
over Okay, there, all right, very good, all right. Well, I should tell you that among my early childhood deficiencies, in addition to being somewhat dyslexic, I'm also have a red-green color deficiency. So I can that the green one is the bright light on the right. Okay, very good, all right. It is the first project in the U.S., expands quality pre-kindergarten by 600 kids. The regional vision leader was the United Way of Salt Lake, a great guy named Bill Krim. The feasibility study was done by Voices for Utah Children, financed by Goldman Sachs, United Way, and some other philanthropists, including your humble servant. Financial engineering was done by Voices for Utah Children, Goldman Sachs, Imprint Capital, Pritzker, United Way of Salt Lake. Implementation in this instance, United Way is the intermediary. When we go back to this model, I don't know why I ever did that. See at the bottom, the Pay for Success Investment Intermediary? That intermediary is the entity that is basically organizing the whole thing. And in the Salt Lake City case, the United Way of Salt Lake is the intermediary. This is very exciting for me in Virginia because we have a organization called Virginia Early Childhood Foundation, which could act as a kind of super intermediary working with United Ways and our special Smart Beginnings coalitions that do prenatal to age 5 work in individual regional areas. Basically, the research which was done, the thing about Utah is that they were blessed by accident of history. They had a very successful Yale undergraduate, Wharton MBA, who had worked 20 years in the investment banking sector and cashed out and went to Utah in the late 90s to go skiing. Her name is Janice Dubno. She has the, I'm going to forget his name, McEnroe. Do you remember the tennis player McEnroe? She dated him in high school. Yeah, one time. Yeah, he was outrageous, and according to her. So she goes to Salt Lake City to just go skiing, and she does a little volunteer work and ends up looking at the data for the preschool and says, listen, by the way, you're saving so much money on special ed assignment. This thing is completely self-financing. I mean, this thing could expand year by year until there are no more poor kids to serve. She could see that because it's her particular genius, and she is an amazing mind. She did the study, Voices for Utah Children study, Janice Dubno, and I'll never forget the phone conference. We're on a conference call. The Investing Kids Working Group was holding these monthly conference calls, about 150 people on a conference call, and I hear, and as a 17-year hedge fund partner, and PhD in finance, and began my career in at the Federal Reserve and 12 years in the House and Senate banking committees. I had, it was always, finance was always a discussion which meant, well, here's what present value means. And we begin with the basics, okay. So we're having discussion about, at that point, we're talking about how do we implement something called Invest in Kids bonds? You know, how do we get this idea established? And then this little voice, this is Janice Dubno from Salt Lake City, Utah, and I was wondering if you could just lend against the present value of a 9-year stream of social impact finance with a discount rate of 3%. And she was just going, I said, oops, now we've got a real one. She knows what she's talking about. So we had the discussion after the conference call, and she began that work, and it's finally come through. The cost ratio, which is the cost of the intervention versus the cost of the remediation, is about 47%. So the cost of the intervention is very low relative to the cost of the remediation. The effect ratio is to drop, this is look at the last 4 lines of that thing. Reduce potential special ed assignment rates of very at-risk children from around 30%, that's 30 out of 100 kids, to less than 3% out of 100 kids. Whoa, remembering that in Virginia, each kid costs $12,000 a year in special ed. That's in addition to its regular school cost. So if you've just dropped it 27 kids times $12,000, I can't do the math, Debbie can or Nancy can, and you could tell me the answer, but it's a very large number, and the present value of it is still a large number, and a bank would be quite pleased to lend against it if you had all the contracts and if you had all the data and you could show that was actually reduced as a result of that program, which she did. And so this program is up and running. Goldman Sachs made a 4.
Rob, we need to wrap up.
Okay,
You
okay.
got blinking red light.
There it is. Goldman Sachs made a $6.4 million 5% loan. Pritzker made a 2.4 to underwrite it to make sure Goldman Sachs got reasonable chance of getting paid back. United Late is the intermediary. These are the other participants. What's interesting here is that Goldman Sachs only gets paid to the 6th grade. And most kids in special ed stay in special ed through high school, certainly through 9th grade. So 100% of the special ed savings go to the public school after the 6th grade and up through the 6th grade. It's 40% or so. So it's a good deal. That's where we are.
Great. Thank you, Rob, for being such a pioneer. And now we move on to Rick Brush, who is the founder and chief executive officer of Collective Health, I also learned in having a little brief conversation with Rick, he spent some time at Cigna, where we had some mutual friends, and so comes with a very strong health background. Rick, pleasure, and it's all yours.
Okay, thanks.